Since the implementation of in-hospital transfer MedRec, it is not recommended you return to the admission MedRec screen once it has been performed. This video will review an alternative method of review via the in-hospital MedRec screen. If admission MedRec is complete, it is now recommended that you use in-hospital transfer MedRec as a form of review or to modify medications instead of returning to an admission MedRec screen. An example of this might be when receiving a patient from the ED and admission MedRec has already been completed. You might like to do a review of meds and historically prefer to use the admission MedRec screen. Instead, we would recommend you use the in-hospital MedRec screen. The first part of this video will demonstrate making a change from the in-hospital transfer MedRec screen, and the second part will show you the difference if you return to the admission MedRec screen. Select In-Hospital Transfer from the Reconciliation drop-down on the Orders page. This screen differs from any other MedRec screen because all of the medications are already defaulted based on their current status within the system. This includes any medications ordered after admission MedRec was initially performed. For example, this IV was ordered after admission MedRec was complete. So why is that important? If you make any modifications to a med while reviewing from this screen, it won't impact the reconciliation status as it would from the admission MedRec screen. Now let's do the same thing in the admission MedRec screen to show you the difference. So admission MedRec has the green check mark to indicate it's complete. Note the IV ordered after admission MedRec was performed is listed here, but is not defaulted to continue, like it was in the in-hospital transfer MedRec screen. I'm modifying the Restoril just as I did before. And clicking Reconcile and Sign to sign the modification. But now the admission MedRec status has been changed to a partial, meaning the system no longer recognizes it as complete, and MedRec audits will not give credit to the physician where credit is due. So in summary, if you'd like to use the admission MedRec screen to review or modify medications after it's already been complete, please consider using the in-hospital transfer MedRec screen instead, to prevent any impact to your MedRec stats, and credit can be given where credit is due. Please note, do not confuse in-hospital transfer MedRec with hospital-to-hospital MedRec.